Hello, my name is Jen, and I'm an LPC with Present Hope Therapy. I am here today to do an introduction into neuroscience to hopefully break through some misconceptions and negative stigma that surrounds mental health. Through my years as a therapist, I have seen countless people struggle with reaching out and getting help when needed. This is because they are ashamed that they need it, they think it's their fault, something is wrong with them, they are not sure how talking can help, or are afraid to talk because it is seen as weakness. These are not true, and it saddens me to see it in so many people. Think of when someone gets the flu or a cancer or even experiences heart, kidney, or lung failure. No one blames the individual for making a mistake and calls them weak and shames them. Instead, people tend to rally behind them, both financially and emotionally, providing support and working with the person to find the source of the problem and fix it. So, why do we treat the brain so differently? It is just another organ in our bodies with a function, and like any other body part, it can get sick, it can get tired, and it can make mistakes. Unlike other parts of our body, our brains do so much I can't even begin to describe its functions. However, here's just one example. Think of when you touch a hot plate. You don't just know that it's hot. Sensors in your hand send a signal to your brain, which then recognizes the temperature, sending a signal back to your hand telling you that it's hot, which goes back to your brain so that your hand knows to move so you don't get hurt. All of this happens in nanoseconds, so fast you can't even note the passing of time. This is just one small example of our brain's capacity and complexity, and yet even in this example, the brain can fail. That is how people can have CIP, which is a disorder where someone does not feel pain. So if something like that can happen, why not depression, anxiety, PTSD, and so many other illnesses? Here at Present Hope Therapy, I hope to not only support my clients in managing their symptoms, but also teach clients that it's okay to not be okay sometimes. It's okay to be different. It's okay to need help. And most of all, there is hope in finding a solution and feeling more confident and comfortable in whatever you are experiencing. Because like any illness, there are always ways to help.